Hey everyone, welcome back to Data Driven Health Radio. I'm your host, Dave Korsunsky, and my special guest today is Tara Viswanathan from Rupa Health. And we are excited to dive into her company and the service that she's bringing to the market. Tara, welcome to the show.
Thanks, David. Super excited to be here.
You guys landed on my radar screen from a mutual friend of ours, Dr. Molly Malouf, and she had mentioned what you guys were up to. And just given all the work we've done in the years in the functional space, it just light bulb immediately went off in my mind saying, this is awesome. And I wanted to have you on the show and talk about what you guys were doing. So first of all, welcome. I'd love to get a little background on yourself. I know you're in the Bay Area, but just a background on yourself career-wise. And then I'd like to hear the founder's story on Rupa. And then we'll get into how this can benefit practitioners in the integrative space, which you guys have brought to market here.
Absolutely. Well, first of all, thank you so much for your kind words. We're pretty stoked about what we're doing too. As you know, being a founder, you have to absolutely love what you're doing.
Will you drive the bus off the cliff for said endeavor?
Yeah, exactly.
That's pretty much the litmus test.
Yeah, and Molly is fantastic. We have tons of mutual friends and spent some good times together. So I really appreciate her sharing that. And what y'all are doing at Heads Up is also very, very important and a critical piece to this puzzle that we're both building towards.
Totally.
Happy to share anything I can about my founder story. I know that.
Are you a practitioner, a medical person by training? Is that how you got into this world?
I am not. I am probably a wannabe, wishful
Me too.
Fangirl of medical practitioner.
I'm a medical fanboy too. I came from the data center world in the technology side of things.
Yep, exactly. I came from the tech and startup side of things, but I mean, it was almost like, what was I doing in my free time? It was understanding what functional medicine was before it even had a real term to it, before anybody really knew what it was.
That's so cool.
Sure, we
were both tinkering outside of our day jobs. We'd go tinker in functional medicine.
Oh yeah, I was and probably still am the weirdo who gets tested every few months and tries everything, does all the diet, everything.
You got another weirdo right here, so not to worry.
I love it. I love my body. To you, my body is like my startup experiment hub.
Yeah, I think on my kitchen table, I have a Great Plains food allergy test, an Everlywell vitamin D test, like 7 devices and all kinds of crazy.
Oh my gosh. It's actually hilarious because people who are listening aren't going to be able to see this, but you can see my kitchen table in the background.
I can see it. Yeah.
You can see multiple test kits on
right on. I had found a kindred spirit here on this podcast. Yeah. This is awesome.
I love it. I actually was attempting to do one of the new stool tests this morning. I won't get into it, but basically it didn't happen because I messed up I accidentally contaminated one of the vials, and like, oh my gosh, I understand how much of a headache this process is. And I'm always trying to experiment. So for those who aren't familiar with Rupa, maybe I'll give just a quick one-liner on what we do.
Yes, please. Let's set the context, because we've just started diving in and nerding out, and people are probably wondering what you guys are working on. So let's take a giant step backwards.
5 minutes in and talking about stool testing.
Big step backwards.
Pause for a second.
Yeah.
What we do. So hi, I'm Tara. I'm co-founder and CEO of Rupa Health, and we make functional medicine lab testing super simple. We're basically the best place to order all, we have over 2,000 different tests on our platform. Any healthcare practitioner can come sign up and order tests within 5 minutes, and we take care of the entire patient experience, including supporting with phlebotomy, all the way to specialized instructions and having 24-hour customer support.
Awesome.
So we do the whole thing, and we're all about lab testing.
So if you're an integrative practitioner listening and you're working with different labs, and there's all of the hassle of procurement and ordering tests and dealing with different companies and getting different results back, and it's just extremely time consuming, first of all, especially if you're using multiple of these labs to do different highly specialized testing. So you guys have basically created the one-stop shop, if I'm paraphrasing here.
Yeah.
But you guys have created the one-stop shop where you can all order all of the advanced functional testing, one portal, and it just makes it easy for providers and presumably patients as well.
Yep, exactly. And it's really the only place that gives you the full experience. So it's not just the ordering all the tests and receiving results in one place. It's also all of the patient support, all of the practitioner support, multi-practitioner clinics. Kind of, people called it your virtual assistant for lab testing.
Nice. So give us a day in the life if I'm listening and I'm a provider and I've been doing it the traditional way. And now I want to get signed up with Rupa. So tell me what that would be like for a provider who's doing it, practitioner, whatever term you want to use, the old way.
Absolutely.
And what would that be like now in my practice?
Totally. So it really varies. We work with everybody from solo independent acupuncturists and small private practices all the way to large hospital systems. So the Rupa is really configurable for your practice. But let me just take a base case. Say you are a practitioner who is seeing patients 5 days a week. Maybe you are doing it solo. Maybe you have one other person in your clinic, and let's say you don't have any front desk staff. I can walk through that example next, but let's say you don't have any front desk staff. You are probably spending between 10 and 20 hours, even though you don't realize it, on lab testing. Everything from logging into each individual portal, tracking kits, explaining instructions to patients, explaining pricing to patients, billing, that whole experience.
Just
waiting for results to come in.
A pain in the ass. Like, did that even get to my patient?
Exactly. Did it get to my patient? What does my patient do? So think about specimen issues. So for example, what happened to me this morning is I had an issue and I needed a new kit shipped out to me. Basically what happens when you join Rupa is you're going to go online to rupahealth.com and you're going to sign up. And within 5 minutes, you now have access to over 20 specialty labs, including Dutch, Great Plains, Genova, all Doctors Data, all the big ones. And they're wonderful partner labs. And you're going to be able to order any one of our 2,000 tests for your patients all in one place. You can, with basically a patient's name, email address, and 2 clicks, you can send an order to a patient with complete price transparency when you're ordering the test. You have choices. Either you can pay for it or your patients can pay for it.
Yep, I saw that on the site.
Yep. And then we do have one of the other things that you get when you use Rupa is, instead of having patients, the burden of testing can be quite expensive for patients. And so what we've done is we've created financing as well. So we have 3-month payment plan, interest-free payment plans for patients.
Yeah, they're expensive. People are sick
expensive.
And they're not getting answers in the conventional channels, and they're looking, or maybe they are, and they're just looking for alternative functional solutions. But it's expensive. Not only are you probably paying the integrative practitioner cash, that may or may not be covered, but then the testing gets super expensive. So the financing option is awesome. I love it.
Yeah, absolutely. We have a lot of people utilize that, and I think it is just one of the things that we've done to really try to make it more accessible for patients and keep them coming back to the practitioner. And so what happens when you send an order is the patient will get a digital invoice. They'll pay. They'll do everything through the platform. They'll get their shipping information, and then basically the practitioner can sit back. So it's about 2 minutes to order a test. You don't have to do anything. We send customized, specialized instructions. You can add any special instructions if you want as a practitioner. Then you just sit back. We take care of everything, including specimen recollections, phlebotomy, all of that. And we will alert you when results have come in, and you'll just log into your Rupa portal and you'll be able to see all the results there for a patient.
Wow, that's amazing. So you can even go above and beyond the instructions that would come from the lab itself, which is
we have our own, human written instructions, including videos and everything that we can find to basically help minimize the chance of a recollection.
Yeah, that's awesome. That first stool test is always a big, big milestone for a person. It's party time.
Right?
Yeah, a little weird at first, not gonna lie, but if you're really someone who's interested in really going deep and optimizing, and especially if you're troubleshooting and diagnosing.
If you live in this world, you're talking about poop a lot.
Yeah.
Yep.
I remember I was at this one conference and I was speaking on like the top 10 biomarkers to live by. And one of my slides was the Bristol Stool Chart. And I realized that I was at the pinnacle of my career when I had a slide on the screen with 7 different types of basically shit and the different shapes of it. And I was talking through it and I'm like, man, 2 years ago, I was talking about cloud computing and data analytics, and now I'm talking about poop. So anyhow, I digress.
Both have very important implications for the world, though. So they're very
You
powerful
know,
tools.
hey, we talk, this is data-driven health radio, right? We talk a lot about different metrics and how people and practitioners use biofeedback to improve health. And there's tons of fancy wearables out there, and Apple Watches and continuous glucose monitors and wireless scales. At the end of the day, all you have to do sometimes is look in the bowl at, first of all, urine, right? Even just the color of that is a huge biomarker that anyone can do for free, is that. And then also looking at stool, because that just is going to give you an indication of how well your digestive system is working, what you just ate, how well your body processed it. And the beautiful thing about those biomarkers is they're free. You don't need a wearable. And there's just a ton you can glean just from the visual part of it, let alone the diagnostic lab part of it. So
Yep,
two
absolutely.
free biomarkers right there, friends, for all who are listening. So Tara, the service, when did you guys start? Because what I've seen so far is incredibly polished. And it doesn't look like a startup company. It looks like a really polished system that's got a really, really nice user experience all the way through. And as someone myself who's building a complex technology platform, I know how hard that is. So how long have you guys been at it for? It looks amazing.
Oh, I appreciate that. Thank you. I'm very lucky to work with really talented people, and that is why it looks so good. But we started in January 2020, so only a year and a half ago.
Wow.
When and that's when we released. It wasn't a full-fledged system at that point. It was just an idea, a prototype. We built it for a couple practitioners in the Bay Area, and within a couple months, we had spread to clinics in 47 states around the country. And
Damn.
we can't be in the other 3 because of billing reasons, but it just went, it just spread so quickly because I think there was such a huge need for this.
Yeah.
And we have been really committed to just iterating and building, making it better as quickly as possible. So we actually release new features, and not necessarily just like fun, nice to have new features. I'm talking about, we get feedback from our practitioners every single day, and then we release that into new versions of the product every single week to make it better.
Cool. Yeah, you guys have done a fantastic job so far from what I've seen. So congratulations on the product and the tech platform working across all of the,
Yeah, to your point though, this stuff doesn't happen overnight. I've been working on Rupa for about almost like 2.5, 3 years now.
So the concept you had started 2.5, 3 years ago, the actual soft launch. Okay, so different concept. Tell us about that.
The life of an early stage company, right? So it's always, I've had complete conviction in the fact that root cause medicine is going to become the standard of care. This is how we're going to treat patients, down the line. We just need infrastructure to make it a reality. We're seeing these incredible practitioners leaving high-paying, stable jobs to go venture out on their own, to start their own functional or integrative practice. And to me, like, that is, I get emotional thinking about it because it's so powerful. You see people who are risking their, financial health in their lives to go do this, and that's meaningful. And so Rupa started as a way to make that a reality for every practitioner in the world. How do we allow every practitioner in the world to practice root cause medicine? How do we build tools? And so the very first thing that we built at Rupa was actually a matching service to help patients find practitioners. And we very quickly, we built a clinic. So we actually built a telehealth clinic that launched in Washington, Colorado, and California. And through that's how we discovered the huge problem of lab testing. So in January last year, we stripped out the lab testing part and offered it to practitioners on their own.
Gotcha.
And then it became so popular, we shut down the clinic, and we've been entirely focused on the lab testing piece for the last year and a half.
Well, the matching system is also super important because even if you want to find a good root cause medicine practitioner, even with the best intentions, it's not always easy to find someone.
So difficult. And so I think that we get a lot of patient inquiries too. And so
That would
we're
make
probably
sense
going
to
to
roll
start,
back in at some point.
yeah, absolutely. And we already have, practitioners on Rupa. They'll every now and then get a message from us saying, hey, we have a patient in your area who's looking for somebody.
Oh, sweet.
So we're already sending people.
You're already
Yeah,
doing that kind of
a
loosely
little
matching
with
it up.
people who come in. Yeah, we have
Yep.
really close relationships with our practitioners. And so we try to just help them as much as we can.
Yeah. And how has it been? One of the challenges in functional medicine with all of this diagnostic testing, one of many, there's the problem you solved, which is just the fact that these are all fragmented labs. But the other problem is that unlike a lot of the traditional patient portals, none of these functional labs have any type of web-based APIs to pull from. So even if you get these great functional tests, you're still dealing with a pile of PDF files. And so we've talked to these companies. I'm sure you're talking to these companies. Some are a little further, like ZRT actually has a legitimately usable modern day REST API. Thank the good Lord.
Yeah.
But they're one of the outliers, honestly. So there's the other problem is, like, how do you first of all then get this data out of the PDF files? And that's something you and I have talked about before. We have our own solution at Heads Up. Presumably you guys will too. So that's another problem that I think we need to tackle here. But when you're speaking with these companies that are making the tests, Genova, Great Plains, et cetera, do you have, I'm assuming they're on board here. This is driving more tests for them. It's removing friction from the whole experience. So have you found that they're supportive, that they actively partner, passively partner? How is it working with these companies?
Yeah. I mean, we couldn't do this without our partner labs. Our partner labs are incredible. We have built very close relationships with them, and our goal is to help them.
Yep.
Our goal is not just to serve the existing integrative and functional medicine market today. We really want to take this mainstream. How do we break out into the world we all know is going to exist in 5 to 10 years, which is every especially primary care physician is going to be having a much more root cause approach. And so when we work with our labs, we take a very long-term view of the relationship, where our goal is just to help them.
Yep.
And help them do what they do better. And so there's our intention is not to go start a lab or to compete with them or anything like that. Our intention is just to spread this to as many people as possible, even beyond the current people they have on board.
But do they have the technology systems that you need to run a business like this, like to run a fulfillment business? And quite honestly, it's kind of like a CPG. There's a lot of workflow that needs to manage, and I just haven't seen these guys really have the systems in place. But you guys have obviously done it.
Yeah. We have an amazing tech team who we've built our own kind of internal systems to work around their systems.
Makes sense.
So
yeah.
Each lab has a different way of handling
Totally.
their orders, everything. And so
Yeah.
we have built internal tooling to basically complement
gotcha.
whatever they have.
So they all have ordering systems, at least. That's good, electronic. So you just got to basically hook into each one of them to handle the ordering.
Not all of them, which is interesting.
Yeah, I'm sure there's
Not
ways
all of
around
them.
all those problems. The point of
Yeah.
bringing up that question, Tara, was that I think a lot of these functional labs still have some work to do in terms of getting their technology up to current spec.
Yeah.
Even having a freaking patient portal for these labs. No.
Yeah. It's also like they're amazing at developing testing, educating practitioners, building reports. Like they have their skill set, and our goal is to just support that skill set.
Yep.
And I don't know, it's probably way more expensive for them to hire an engineering team or an outsourced engineering team and start to build these things
Sure.
rather than working with other companies to do so. And so if we can help in any way, we're trying to, even just like, here's how to build, or here's how to think about this problem and stuff like that.
I guess so. I just feel like it's table stakes these days to have a legitimate patient portal and an API, like if you're going to be a player in digital health, but that's just not the case when we talk to a lot of these companies. They're definitely starting to hear it now more than ever. So when we're speaking with these labs, they're definitely saying, yes, we're getting tons of inquiries asking us to have more up-to-date technology infrastructure, patient portal, APIs, that type of thing. So I think they're going to start coming around. And honestly, that's also been a big reason why there's been a lack of, I think, adoption has been slower, is just because they seem to be, like you said, very good at the testing, but missing out on some of the more modern
It,
pieces of being a digital
and
health
that's
company.
exactly why we built Rupa, right? So essentially any doctor wanting to order can bypass and use Rupa to access all of the testing without having to spend a ton of time ramping up. It's just an easier sell to them to say, hey, instead of having to learn one by one, which many doctors are basically saying, well, I don't, that sounds too complicated. I'm not going to do it, especially when you go into primary care and things like that and internal med. That's too complicated. I don't want to do that. Well, we'll make it very, very easy for you to start accessing this stuff. Because not everybody is as motivated as somebody who quits their high-paying, stable job, does root cause medicine. We're entering an era of more and more physicians interested, but not all of them are going to take the extreme amount of time to ramp up in this way. So how do we meet them there?
That makes sense. The other thing you mentioned about root cause medicine starting to become more standard of care, I share that same vision, that same aspiration, just because the way our society as a whole is advancing or not advancing, it's becoming increasingly important to have insights into lifestyle driven factors of disease, which means you're looking at people outside of the office, and you're looking more at the underlying factors that are driving health conditions, which is microbiome, environment, heavy metal, toxin exposure, all the stuff, quite honestly, that, at least in my personal experience, my traditional doctor, it's not even on their radar screen. Even some of the blood tests I ask for, they're like, what's that? And it's that's a challenge. So I think making this type of testing more accessible, you mentioned health systems and hospitals and others that are you seeing more conventional groups now starting to look at this type of diagnostic testing?
Yeah, absolutely. I think we're in the early stages of it. We're in the infancy of it, but absolutely. For example, one of our partners, one of our customers, I can't mention their name, but is a large health system.
A large health system in the United States
large
of
health
America.
system.
Yeah.
Yep, in the US, and they are now putting integrative medicine with these lab testing in every single one of their clinics.
Dang,
they're on a mission to do that in the next 3 years.
I love it. Yeah.
Yep.
Yeah. We're all going to be looking at poop, friends. That's so awesome though, because like so many people's microbiome are just jacked from different dietary things. So many people have had mold exposure or
myself included. Yep.
Yeah, the toxin load, and it's not even on the radar screen in traditional diagnostics. So that's like so awesome to see that could become reality. For us as a digital health company focused on biometrics, when we started this, there was no insurance companies paying doctors to do remote monitoring at all. It just didn't exist. And now remote patient monitoring is becoming an extremely profitable service for physicians. So that's another huge trend. And remote patient monitoring, in my opinion, is basically lifestyle monitoring. So being able to look at someone throughout the day and understand when certain biometrics are going out of range and cross-reference that back to lifestyle factors that the person may or may not even be aware of. And now you're starting to do continuous care. So even in our industry, we're starting to see the changes happen very quickly, where things that were not reimbursable at all, hence why we started in the integrative world, because they would still pay for our service because they inherently understood the value of the data. It's now starting to become something where there's actually reimbursements from the payer system for doing this, at least in our business. Are you seeing anything, Tara, on that side of things where more of this would be covered by insurance?
Yep, we have microbiome testing that's covered by Medicare entirely. And
awesome.
so
which one is that? How does that work?
Actually, most microbiome testing is on our platform. And so, and a lot of it is covered by commercial insurance as well.
Oh, sweet.
Not entirely, but it
Yep.
is. And so we're starting to see more and more. And I think as chunks of research come out, as it has with the microbiome, we're going to start to see that more and more in different areas.
That's also going to lower the barrier if there's an insurance aspect that covers it, because I've always ended up paying cash for all of that testing, and you guys will have answers for that, for just the highly proactive people that don't have a condition per se. You'll have financing options for people who are paying cash to make it more accessible. You'll have options through the payer system depending on your insurance. So that's also, I think, going to open this up
Yep,
more broadly.
absolutely. Accessibility is huge.
Yeah. And what about, I know that you and I have some time scheduled in a couple weeks to do some training where we're going to talk about remote patient monitoring for your community. But just going back to the initial vision for Rupa, which was how do you enable more doctors to make the transition? Are you doing a lot of that work, like helping? If I'm thinking about this and I want to do this and I don't even know what these diagnostic tests mean, I've never run them on my patients before. Are you guys dabbling in the education side of it at all?
Yes, absolutely. We have more exciting things to come very soon, but that is something we have seen a huge desire for, is basically how do you interpret and understand all of these? How do you get started with testing?
Yeah,
Because
totally.
there's so many options.
Yeah, we're in the same boat.
That's why, exactly. It's why we started building Rupa University, which is
Yep.
essentially like where you're coming to speak at that, but basically free live classes for practitioners and how to understand and interpret lab testing and various other aspects of running a functional medicine practice.
Yeah, we just started Heads Up University. How about that? And
Love it.
same thing. It's like, okay, all of these practitioners are interested in remote monitoring. Like, okay, how do I read my client's Oura Ring data? What does this temperature deviation mean? What does this heart rate variability mean? It went up. Is that good or bad? How do I get my clients set up with a continuous glucose monitor? So like, we're just looking at different biometrics than you are, although there's some overlap. So we've kind of started the same thing, which is how do I get from 0 to 60? And you know, a lot of the times you actually have patients that are looking at this stuff more than providers. So you can't show up on the consult and the patient knows more about the testing, the data than the provider.
Gosh. I have been that really annoying patient before who researches everything before a call.
Yeah.
I apologize to all my doctors out there.
Yeah. Me too. You know, I was working with a functional doctor in Austin, Texas, and I was living in the Bay Area, and he was sending me test kits for functional labs, blood work to Quest and LabCorp, and I was measuring different things at home. And that was kind of, I have this ungodly spreadsheet that was version 1 of Heads Up. And I'm just like,
oh, me too. Yeah.
We should have a little spreadsheet war. See whose was nerdier.
I love it.
I still have mine. I pull it up from time to time when I'm talking with investors or other people, and they're like, how did this get started? I'm like, let me show you. And then I pull up the spreadsheet and I'm like, I'm not even a medical person, and I could see trends in this data that my doctor can't even see. So that's a major problem right there. So anyhow, anything else, Tara, that you would want to share to practitioners who are listening, who want to get started with you? Any other just general comments for the practitioner audience here? We're going to have more coming out between our two companies, I'm sure. I've just have really enjoyed every interaction we've had with you and your company so far. So I think this is the beginning. But just as we're starting to wind down here, any other guidance you would give to the practitioners listening here?
Oh my gosh. First off, if you're
really just how to get started.
Practice, if you're starting your own practice, many of us at Rupa know what it's like to start something from scratch. It's incredibly difficult. I almost just want to give a word of encouragement. Like, you're fighting the good fight. Keep going, and you'll get there. I'm so inspired by every single practitioner out there who is building something that is so meaningful in this world. And I think that it's not easy, but it's worth it. So that's number one, right? Just keep going. and it will get easier.
It's not easy, but it's worth it. That is
Yeah.
a golden nugget right there that Tara just dropped for us.
And I feel it, right? Running, and you get it, like running a company is not easy. It's worth it, especially when you care about what you're doing. So that's number one.
Yeah.
And then I'd say on the lab front, if you're doing labs right now, email me, check it out. My email is tarav, TARAV @rupahealth.com. I'd love to hear about what you're doing right now. I'd love to tell you about Rupa. If it's a great fit, awesome. If it's not, like, no worries at all. But happy to like help you make that transition personally. And then if you are new to labs, check out Rupa University. We're learning every day there, and please send us feedback.
Free resource at Rupa University, right? You can just go start checking it out, check out some of the online courses, and that's a really nice entry point.
Yep. And we have a lot of resources. We actually one of the top questions we get from doctors is, what EMR should I use? So we did a deep dive on EMRs, and we have a new blog post out that is basically comparing and contrasting all the different top EMRs in that space as well.
Cool.
Stuff like that on the site.
So Rupa Health, there's a ton of great resources at Rupa University that you can start checking out. Tara's been gracious enough to offer up contact info if you want to get started with her company. So it's not easy, but it's worth it, Tara, as we both go down our respective startup endeavors. Thanks for bringing your company to life and your service to the world. I think it's awesome, and I wish you guys the absolute best of success.
Oh, thank you so much. I know this is just the beginning of us hanging out and talking and building things together.
Sounds great. Thanks for your time, Tara.
See you, David.